Hi guys, welcome to my channel. Hope you're doing well today. And today we're going to be talking about healthcare. So let's dive into the videos and watch.
I'm grateful that I'm a physician in the United States. I trained at some of the best places, and it's allowed me to be a good doctor. It's not just as far as knowledge, but my ability to communicate, my ability to care, and having the resources. But the part that always astounds me is that's only all that I can control in the care that I provide and the care that, whatever institution can provide. That's very local, that's very specific, and it can be related to a university, a medical center, etc. But the reality is I'm privileged, right? I'm privileged because I'm a physician. I know what good care is. I know what bad care is. I know what the standard of care is. I know what to expect. I know these things. Basic things like if you need to get a high level of care for cancer, you go to MD Anderson, right? Or you need orthopedic care, you go somewhere where they do it all the time. But most people in the United States, they just show up. They see a doctor, they assume that they're going to get the best care. And that's not true, right? We know that. We know that your care is based on where you live. It's based on, who your initial primary care doctor is, who the specialists are, what's available locally. And so we know that based on where you live will determine what type of care you get. And you may not even have the subspecialty that you need. The problem is right now, things are getting worse. We are losing the amount of physicians that we have. They're retiring, and we're not training enough of them. And the current administration is making barriers, but we will have less doctors. We have to be vocal. We have to be active. Don't just assume that you have the best care. You have to be knowledgeable and ask those questions. But a lot of this, we have to work on this infrastructure. We have to be able to make this better for all patients, from kids, adults, our parents, and that's going to require a lot of commitment, infrastructure, and it's currently being broken down, right? And so those are the concerns, some thoughts, some concerns, and let's hope for the best and continue looking forward to how we can make things better.
The U.S. healthcare system is broken. Do not allow you or your loved ones to be discharged from a hospital if it is not safe. You have the right to say this is not a safe discharge. Had a patient who, these are my lunchtime rants, had a patient who was sent to us by the hospital. Just the clinicals, we did not realize that the patient was already discharged. Found out that the discharge happened at late last night. Like the patient got home at almost midnight, and the patient didn't even know that they were being discharged. The patient's daughter didn't know. The patient's 99. What we also didn't know is that because of zero clinicals that we received about a Pleurix catheter that had been placed. So we found out this morning because the daughter called saying, "Where are you? You're supposed to come and do all of these things." And it's like, we didn't even know you were discharged. We didn't even know your mom had a Pleurix catheter placed. And the daughter had zero training in the hospital. So no ordering of supplies, none of that. And didn't even know that her mom was going to be discharged until 10 o'clock last night when they said, "Oh, by the way, EMS is coming and taking your mom home." Do not allow the hospital to discharge you or a loved one if it is not safe.
United Healthcare is a bad organization. They deny coverage. They make it harder for people to get the things that they need. They will delay people from getting chemotherapy, from getting heart surgery. And they do it because they deny, not based on intelligent people looking at a claim, but based on algorithms that they use. Which means your health care, when you're covered by United, is potentially delayed. And delayed treatment can have devastating consequences. Corporations are not doctors. They shouldn't be practicing medicine. In California, it's against the law for insurance companies to undergo what we call the corporate practice of medicine. It is a corporation, United Healthcare, that needs to be regulated, needs to be broken up into separate parts, and needs to be carefully and tightly controlled because clearly they can't control themselves. They overpay their executives, they overpay their board of directors, and they do that because they think they deserve your policy dollars instead of having your policy dollars be used for your healthcare. What happened to the CEO is inexcusable no matter how bad the corporation is. But United Healthcare, right now, as it exists, is an organization that should not be practicing medicine and should not be doing the things that they're doing. They need tighter corporate regulation, much like we regulate utility companies.
So I'm going to go on a little bit of a rant here about the health in our current society in this country being America, but I'm pretty sure it's starting to happen in a lot of other places as well. So I was an ICU nurse for almost 7 years. And back when I first started my ICU career, I was in a cardiac ICU, intensive care, saw the sickest of the sick people. And when I was in this, I would get occasionally a young person and see young people coming up from the ER. But if we did, it was rare. It was rare if any young person had a heart condition, or minus like pediatrics. I never worked with pediatrics, so that's different. But for adults, I never saw young adults coming into the ICU with serious health issues. I recently left bedside nursing for several reasons, but in the last year or so that I was in the hospitals, so it was like 2023, I started seeing younger and younger people coming into the ER and being in the ICU. And alongside that, I'm also looking at the people that I know, my like friends, family, everybody around me just seems to be getting sicker and sicker. There are young people who have cancers that come out of nowhere. These are healthy people who have no prior history of anything. They don't have it in their family history. They are fit. They're eating the right foods. They're not doing anything wrong, and they are developing cancer. I remember there was one lady who came in, and she was in her like 30s. I want to say her early 30s. And she was telling me and another nurse how she had to get all these organs taken out because she had some cancer that just randomly showed up pretty much overnight. This is not normal. Okay, let me just say that again. This is not normal. Not only is cancer popping up, but so many other issues. GI things that haven't really been a thing. There is now autoimmune diseases that are coming up. So many people you talk to nowadays, oh, I just got diagnosed with lupus, I got diagnosed with POTS, I got diagnosed with so many different things, and that is not normal. Like, that never used to happen, you guys. And then you have all the people who are trying to figure out what may be wrong with them. And you have people who are fatigued and have brain fog every single day. And that never used to be a thing when our parents were younger. Like, if you think back to it, like, and infertility, you guys, infertility never used to be the rates that it is now. It has skyrocketed. And there has to be a reason. There has to be a reason for this. And honestly, I have no idea. So if anybody has any ideas, let me know. But I truly, as a nurse of 7 years, I'm scared.
Okay, I want to talk about the importance of non-institutionalized education. It's an issue. Usually at schools, I see that kids are just told, these are facts, and this is what we're teaching you, and this is what you're going to learn, and you're not going to question it. I'm an educated individual who went to school in a different country and went to school here. One of the things I noticed that in other countries, they encourage that you question everything, and that you do your own research, and that you back up that information that you're questioning with more questions and more information. But we don't do that here in America. So let me give you an example. I wanted to go to an appointment, and because I don't just blindly go and my insurance changed, I started asking questions and found out that the stuff that I need to get seen for isn't covered by my insurance. And I'm wondering, why aren't they covering this? And then they're trying to give me this whole runaround. So I decide, you know what? I live by Mexico. I'm just gonna go and do my own research, and lo and behold, I don't need to go through the hoops. I don't need to go through all this tedious nonsense with seeing a primary care. I don't have to establish that. I can just call an imaging center because I need an MRI for my back. I can just call the imaging center, and guess what? I was able to get an appointment for the very next day, and it's going to cost me out of pocket, even after gas for traveling and a hotel stay, less than $500. But even with the 60% that my insurance would have covered, let me say that again, even with the 60% that my insurance would have covered and the 40% that I pay, it was going to be about $2,000. Thank goodness I question everything and I do my research and I'm not confined by this box that America is trying to put me in, because now I'm going to go to Mexico and I'm going to get what I need.
I think the way we're handling healthcare in this country is pretty batshit insane. How are you allowed to get a surprise bill for $37,000 like 6 months after you were in the hospital because the hospital system decided to just overcharge whatever they wanted? Because apparently they can do that. They can just charge whatever they want to the insurance company and then they have to just fight it out. So now I'm stuck with dealing with it on my own. I have to get lawyers. I have to just, lose sleep, and they can just do that. That doesn't. How are we allowing them to do that? Why?
Hey everybody, just wanted to provide a quick update on my cancer journey. I went to see the doctor that thought that I had that knew there was cancer right away prior to the biopsy, and I figured that she was going to refer me to a general surgeon to have it removed and then to oncology to start treatment, but she felt that oncology referral was more important. So without getting too personal about it, as far as doctors' names are concerned, she referred me to an oncologist. She physically called him from her cell phone while I was in the room. She called this particular oncologist and let him know my issue, and she's like, you know what, I need you to see this patient like ASAP. There's an urgency to it. Whatever. She told him everything that was going on. And the doctor's like, yeah, that's fine. But what, I guess it shouldn't baffle me, but what the first thing that he said was, well, what insurance does she have? And so she told him what insurance I have. He's like, well, I don't think I accept that, but no problem, like send me her information, I'll see her or whatever. So after I left the office, I called my insurance company and I was like, hey, can I go to this doctor? Like, I have cancer. This is an oncologist. It's an initial referral. Can I go? Do I need a referral? Like, what do you need? And they're like, no, you can go ahead and go. He's in contract with us. He's in network. Go ahead and go. But just know that any procedures you're going to need thereafter are going to need a prior auth. Understandable. So I called this particular doctor's office to make an appointment. Mind you, I'm a nurse. I send a lot of my patients to oncology doctors. This doctor comes very well recommended, very good oncologist. Don't have an issue with the doctor specifically. So I called and I was like, hey, my name is Lizanne. I'm calling because Dr. A, B, and C talked to your doctor. And the staff member was very passive aggressive. She's like, yeah, I know. We already talked to, the doctor already talked to your doctor. And I'm like, okay, well, can I make an appointment? Well, we don't accept your insurance. And I go, no, but you do, because I just got off the phone with the doctor, the insurance. And they're, we don't accept your insurance. We're going to have to talk to billing first to see if we can even accept your insurance, because I don't think that we do. I've never heard of that insurance. And we'll call you. And I'm like, well, but this is urgent. Like, I have cancer. Like, I need to be seen. Like, there's an urgent, like, the doctor called your doctor. Like, I need to get seen. No, we'll call you after we verify benefits and if we can take you. And I'm like, okay. So I hung up. This is what's wrong with the healthcare system in the United States. I'm mind blown that I was just passed on as another patient, and they're just looking at me like dollar bills, like I'm a moneymaker for them. I'm just sad that I was treated the way I am, and I feel bad for people who don't know any better, people elderly, and people who just accept it and like, okay, and then hang up. Like, I'm gonna fight, and I have to call every day and bug them and pester them until I get an answer, until I get an appointment. If not, unfortunately, I'm gonna have to go to Texas Oncology, and hopefully I can get seen there faster. But this is what's wrong with the healthcare system in the United States. I'm so disappointed. And as a healthcare worker, I can't tell you how disappointed I am. There are no words. But please pray for me. Have a good night, y'all.
Healthcare system is so broken. Patient tries to go to their primary care doctor. Primary says, sorry, can't get you in for 6 months. Patient goes to urgent care. Urgent care says, actually, we can't take care of that. Go to the ER. Comes to the ER. Sometimes we do things. Sometimes after they wait in the waiting room for 8 hours, we get them back and we're like, yeah, no, actually you're okay. You can be discharged. After all that, the patient still doesn't have answers. Can't get into follow-up, doesn't have care coordination. And now they racked up like what, $3,000 in ER bills just for us to say, go back to your primary care doctor, which is where they were trying to go in the first place, back to square one, except now more broke, more exhausted. We have a system that is severely underfunded, understaffed. I'm tired of all these band-aid solutions. We need access, resources, prevention. We need enough staff to take care of these people. This is one of the reasons why nurses are so burned out and patients are fed up. The system isn't just broken, it's bleeding.
All right, Americans, can we talk about how much you hate your jobs? I'm an American who has been living in New Zealand for the last 11 years. I love it here in Aotearoa. And the reason for that is we don't have health insurance that is tied to our employers. In New Zealand, we have a single-payer healthcare system that is funded by our tax dollars for all New Zealand citizens and legal residents. Companies, corporations, they do not need to offer their employees insurance healthcare packages. Employees here can come and go as they please, and they do not have to stay tied to a job that they hate simply to stay on insurance. I cannot tell you how many family members I have back in the States who are staying in jobs that they fucking hate just so that they keep their health insurance. Back when Obama was president, he wanted a single-payer healthcare system that is very similar to the rest of the world, like New Zealand and Australia and Canada and the UK. The insurance company lobby didn't want that, and they have enormous amounts of money and power. So they lobbied Congress hard and threatened all of the GOP congressmen and women with primaries, and they threatened to pull their donations if they didn't fight Barack Obama on that. And so that is why we have Obamacare. Obamacare is a bastardized version of a single-payer system that most countries have. It gives insurance companies a lot more power than any other country in the world that has a single-payer system. Can you imagine if you could leave your job tomorrow, a job that you hated, and you didn't have to worry about your health insurance? Can you imagine the relief you would feel if you were laid off and you didn't have to worry about your health insurance? So many people who have aspirations to start small businesses in the United States can't because they need health insurance from a big corporation. Having healthcare tied to employment in the United States is a form of corporate, modern, indentured servitude. This is how they keep you working for their company even though you hate it, and even though they treat you like crap, and even though they only give you 2 weeks of vacation off, and even though they could pay you less than what you're worth, but they'll give you health insurance as a carrot to dangle in front of you. And let me be very crystal clear. The only reason why America doesn't have a single-payer healthcare system similar to the rest of the world is because Republicans have voted it down every single time. My hope and my prayer is that once all of this is said and done and Orange Twitler is out of office and maybe the Republicans are kicked to the curb, fingers crossed, Democrats will wake up. The progressive movement will happen, backed by the American people. It's not about right and left. It's not about red versus blue. It's about the rich keeping you guys enslaved, using healthcare and insurance companies as a tool to keep you oppressed.
Crazy. Going to the hospital, getting a bunch of tests run on you, not knowing the price of anything, and then a week later they send you an outrageously expensive and high bill. It's really sad that the healthcare billing system is notoriously complex, corrupt, and just lacks transparency. There are so many people that don't even want to go to the hospital because everything is so expensive and their healthcare companies do not cover anything. It's really sad, and I hope there's something eventually that can be done in the future to fix this major problem.
About pre-med stuff on here, so I've been keeping up with all of the stuff happening medically with our government, and it's getting more concerning by the day. I actually think I've spent the past 2 weeks in complete fight or flight mode.
I'm very stressed about it, and I know there's little that I can do personally, but this is something that I know I can do, and I know a lot of people on here can do. We can spread the word and get people to know about it. Why would you know or care about any of this if you're not interested in going into healthcare or already in healthcare? Well, let me tell you why. Our healthcare system, though deeply flawed, is under attack hugely right now, and it needs to be known. This isn't even inherently political because of the fact that, I don't care what side you're on, you're going to be affected regardless. I don't think this is fear mongering at all. Our healthcare system is low-key hanging on by a thread, but these things are kind of making it worse. Yes, I agree it's a flawed system that needs fixed, but making it worse and making healthcare less accessible to people is never going to fix it. The temporary suspension of J1 visas. Okay, so if you're not aware, July 1st is when residents start their residency program. And we have a lot of people, they're called IMGs, they're international medical grads, okay? And they use these J1 visas, okay? Not having access to them now could delay their start date, which is potentially pretty catastrophic. Hopefully this gets fixed and figured out in time for where we don't have to see the effects of this, but if it's not, rural areas and underserved communities are going to be hit the hardest, to be honest. It's going to be seen in primary care, and it's the fact of the matter. I talked about this before. It's the current bill that's going through Congress that passed through the House and now has to go through the Senate, proposing to get rid of Grad Plus loans and then cap the amount of loans that somebody can borrow at $150,000. If you know how much any professional medical program costs, you know that that's not going to cut it. Students to only turn to private loans, ? What we're going to see there is a shift in higher disadvantages for lower income students, and the barriers are just going to grow for them. As a result of this, there's going to be more trickle down stuff with primary care and shortages and all of the things.
The House and Senate have agreed on a resolution that could slash healthcare access for millions of Americans. Let's talk about it. I'm Simon, universal healthcare activist. So what's this about cuts to healthcare? Well, there's currently a big piece of legislation sliding its way slowly through the government where major cutbacks to Medicaid are being considered. Medicaid is administered by the states, but it depends heavily on federal funding. Any federal cuts to the Medicaid program being cuts to access, to eligibility, to healthcare for many of the poorest Americans. Additionally, 12 million people currently on Medicare also rely on Medicaid to cover things that Medicare does not. In a country where healthcare coverage is already so bad, the current lawmakers in power are aiming to make it worse. So what can you do? Well, on the grand scale, of course, protest cuts to these essential services, Medicare, Medicaid, Social Security, and also support lawmakers that defend these essential services and want to expand them. And on the personal level, if these changes do come to pass, make sure that you, your family, your friends stay updated on what's going on so you don't get caught unawares and thrown into lifelong debt if you need medical care. Stay updated on your state's Medicaid eligibility requirements, and also be aware that if you have to get ripped off by getting private insurance, there is a premium tax credit you can get, which can maybe alleviate the financial burden a little bit. And of course, support universal health care for all Americans, so every one of us can get affordable and accessible health care when we need it. I'll talk to you later.
Oh, sorry I haven't posted in a while. I was really sick. I don't know what I had. Strep throat or flu, norovirus. I don't fucking know. Anyways. I still had to go to work sick. I'm new at my job. I like my job, but I'm on a probationary period. If I call off too much for being sick, then I'm just going to lose my job. Healthcare in America sucks. You have to go to work. You have to go to work sick. All the nurses come to work sick because they can't keep calling off because they're sick. So they come to work and they get people sick. I'm wearing masks. I'm doing all the things, the remedies to take care of myself, but it doesn't matter because you're sick. It is the worst feeling in the world to come to work and take care of people and have to be at your highest acuity of thinking and critical thinking, and you can't think straight because your head is so congested and your throat feels like you're swallowing glass. When I lived in Brazil, I got sick with a stomach issue, went to the doctor, and I called my boss and I'm like, I can't come into work. I'm so sorry. I'm sick. I don't want to lose my job. And they said, oh, okay. Don't worry about it. Just come when you're feeling better. So I was going to come in like the next day. I'm like, I feel terrible. I'm going to come in anyways. And they said, no, don't come in. Come in when you feel better. If you can't, if you're sick, you can't work. It's that simple. This is how it is in other countries because they have health care and we're enslaved to our job for health care. It's a nightmare. I hate it. Anyways, this is coming from a nurse. What's your thoughts on it? I'm sure everybody's going to come back and be like, I don't want to pay for anybody else's health care. I do. I want to pay for everybody's health care. I want to pay for the CEO of Walmart to screw over and exploit their employees and put them on food stamps because they don't pay them well enough. I want to pay for people to have preventative health care so they never have to go to the hospital and see me. I remember going to work and in an ICU and my boss came in sick and she's like, oh, it's okay. I can work. This is an ICU. You're killing people. These people are so sick. They have no immune system and we're all coming to work with a cold. Just why can't we take care of our healthcare workers? Why do we have to give all the money that the hospital makes to the CEO and the administrator and these insurance companies and these pharmaceutical companies? Why can't we take care of the community? That's what I want to know. I'm sorry. I'm done with my soapbox rant for the day. I'm done. Okay,
let's talk about the healthcare system in America. Obviously, I broke my arm. This happened about 3 weeks ago, 3.5 weeks ago. You want to know how hard it was to get a cast and get seen for my broken bone? So I break my arm probably the 3rd week of April on a Saturday. I was out of town. My healthcare did not cover anything out of town, so I had to wait 3 days for anyone to see me. It was very swollen. It hurt. I went to CVS and I just got one of those little like braces to just kind of get me by until I was back in my city. Now I have HMO healthcare, so any type of anything like specialist, I have to get a referral for. So I needed a referral to see the orthopedist so I can get a cast on and actually get seen and properly taken care of. Whatever. So I go to urgent care because they've given me referrals in the past with previous health insurances that I've had. I get to urgent care and they were like, hey, it's gonna be $35 and no, we can't get you a referral. Sorry. They took the x-rays at least. So at least I have x-rays and they saw that I did have a fracture. It was a whole fracture through my, whatever the biggest bone is in your arm. They say you're gonna have to see your primary doctor. I have not been able to get a hold of my primary doctor at this point for months. I just got this new insurance about 6 months ago. I have not been able to get a hold of their office. I have not been able to see them. And like, I have multiple underlying conditions. So on top of that, I now have a fracture and like, I still can't get a hold of them. So that was just another annoying thing. So I'm like, okay, maybe the hospital can help because sometimes, usually the hospital is able to give you referral approvals and whatnot and get you to the orthopedist, or usually they even have one on site. I went to the, here's where it gets bad. I went to the hospital. Then they say, we can't get you a referral to the orthopedist, so you're gonna have to go see your primary doctor. So I'm like, okay, so if I can't get a hold of my primary doctor, like, they're like, not my problem, but let's at least get you in a splint so that it can hold you off until you can see your doctor and get this referral so you can go see the orthopedist. Like, it was just like, so I'm like, okay, a splint, if you don't know, which I didn't know and now I know, it's straight up like a white, it feels like cardboard, like it's straight up just paper that they mold and they just put on your arm to kind of hold it together. It's literally paper, like it's paper. So they just take me to the back room, put some paper on, and then they go, that's gonna be $350. $350. If I didn't have family to help me with that $350, and thankfully, like, I have a job and everything, but people that don't have that,
you're shit out of luck. So now in total, I'm out $385 just for that day because of urgent care and the hospital, and both turned me away. I have a little splint on my arm. It goes all the way up my whatever, but it's still not a cast. It's still not going to hold me over. It's still not properly dealt with, and I still have a fractured bone. By some miracle, I get a hold of my primary doctor that day somehow. Thank God. And thankfully they ended up being really nice and super sweet. They saw me within the hour. Thank God. Again, I had to Google like 6 different phone numbers in order to finally get the correct phone number for them and actually get a hold of them. Mind you, I've done this for like months. So like the fact that I got a hold of them that day was just incredible and pure luck to me. So they finally give me this referral approval to see the orthopedist, and they're the only ones that can put the cast on, yada yada. I call the orthopedist. And again, this is Tuesday. My arm has been broken for 3 or 4 days now. And they say, hey, we're the only ones that can help you. We're the only ones they referred you to, but we can't fix your arm or put you in a cast until next Monday. Next Monday. I'm like, why can't you see me today? This bone is literally broken. This is important. I'm so confused. And they're like, well, we only have one person that deals with wrists and he only comes in Monday. So you have to wait till Monday. Why am I paying over $358 a month to just keep getting turned away, especially when I have serious injuries like a broken bone? So now I'm getting my family involved. And again, I'm very lucky to have family, and my family just goes, no, you're gonna see someone today. They're gonna put a cast on you. We will go find somewhere else, and we're just gonna have to pay out of pocket, and it's gonna have to be out of network. So I end up going someplace that my grandma has been to before that's actually really amazing. And they saw me that day, but it was not in my network for my HMO network, whatever. It wasn't on my list of approved, whatever. This is all so confusing. And I was able to see them, but it was another $350. So I have now total spent over $700-800 at this point. To just go get a cast on. So thankfully those people were really nice and they put this cast on me and whatnot. But it's just the fact that I had to go through like multiple days, multiple doctors just to get something as little as a broken bone fixed. And like little meaning like this is still serious, but like some people don't have the privilege that I do to have family and to have money to help deal with these situations, and they end up just getting lifelong injuries. I know so many people that have just been like, nah, I wasn't able to go see the doctor, so I just have like wrist pain or ankle pain because I was just never able to go deal with my broken bone, and I wasn't able to heal it properly and fix it, and now I just have lifelong pain. I didn't want that to be me. Like I work a 9 to 5 on the computer all the time, and also just like whatever you do in life, like you don't want to have to deal with that pain for the rest of your life. That sucks. So I'm frustrated at the system. I'm frustrated that even me, who has privilege, had to go through all these hoops to just see a simple doctor for a broken bone. I'm tired.
Thursday morning thoughts. Do you know how I know the United States is not the greatest country in the world? Simple. Because our healthcare system absolutely disqualifies us from even being in that discussion. Just think about this. Imagine you're talking to somebody who has no basis of knowledge in the United States, in how healthcare works, anything, blank slate. And they just ask you the simple question, hey, if I lived in your country, would I be able to get the healthcare that I need if I were to get sick or have some medical need? Think about how many questions you would have to ask that person before maybe landing in the space of saying, yeah, you'll be fine. Imagine how many questions. You might just start with, well, are you exceptionally wealthy? Or are you really poor? Do you work at a job? Do you work at a job where they pay you wages? Does your job offer health insurance coverage that you can purchase? What's your current age? Do you have children? Do you have a spouse? Do you want to insure them also? How old is your spouse? Do you or your spouse have any pre-existing conditions? What state are you in? Are you or your spouse disabled in any way? If so, what's the nature of your disability? Do you take any medications currently? Are you a veteran? And I could go on and on and on and on. And the fact that we would have to have so many qualifying questions and answers to know if this person could even have access to basic health care in a country that has the resources that we have, it's embarrassing. The fact is, America's capitalistic approach to providing health care has made a system that's too profitable to make good.
Thank you for watching, guys. Please do not forget like, share, subscribe. And if you have any questions, suggestions, please write in the comments below. I will be happy to read them all. And this is all for now. Be safe, guys, and see you in the next video. Bye.